Okay, hi, thank you. Good morning, everyone. Thanks for joining us. So we're going to tell you a little bit about some work that we did that started in 2017 and has been fully live across the trust since 2018. As far as I'm aware, there isn't a single clinician in our trust who uses anything else other than voice dictation for all outpatient activity at the moment. So we're going to tell you a story of why we did this work. And we should say right at the outset that we did this work to redesign our whole outpatient workflow. So we used VR and Nuance's product as a nudge to help us think about how we could redesign our whole outpatient workflow experience. And I think that's helpful. And I think it's helpful to think about services and using new products as a nudge to make you do the quality improvement that you've always wanted to do. So our aims in doing this were to improve the accessibility of information, and in particular to have content that is generated in outpatients easily accessible in the same way as an inpatient entry embedded within Cerner Millennium. And we wanted real-time documentation of clinic letters. And in our previous workflow, we had significant delays, which we'll show you some data on later on, but people would dictate a letter. That letter would then go to a secretary, a physical person secretary on site who would type it. Then we would review it. Then it would go back to the secretary. And then perhaps at some point in the future, the patient and their GP would receive the information they desperately needed. We wanted therefore to reduce letter turnaround time and to reduce costs. And we should say at the outset, our aim for reducing costs was primarily around software. So trying to reduce our legacy software that we were using. We did not set out with the intention of reducing our secretarial budget. And we wanted to release secretarial time rather than release secretaries. And people were very suspicious of that at the beginning of the project. And we'll talk about how we tried to get around that barrier. But there are many, many other things that my secretarial support staff and my department staff do that are essential to patients getting good care, which do not need to involve them listening to me whittering on. And also we wanted to use the latest voice recognition technology, recognizing that previous solutions involving humans had significant variability in performance and significant variability in results. And that goes for the people dictating and for the people transcribing. So Paul's going to talk us through actually what we did.
So in terms of technical changes, the key thing that we needed to introduce was something that supported an electronic workflow, a dashboard or a work list view. So on the screen, you can see the custom solution that was developed in terms of presenting effectively the clinic list for the clinician, but also some key pertinent other bits of useful information, as well as some functions to navigate into the patient record and to complete some of the documentation. So the electronic work list then links in to some documentation. We produced an outpatient clinic documentation form, but also an outpatient outcome form to enable the clinicians to record in real time the consultation, but also then the actions and the next steps. And then that feeds into automatically producing the clinic letter, for which, as you can see on the screen, there's a patient's copy, there is obviously a GP copy, and we had a copies to function as well. And then those letters were available for export and sending onwards via either mesh direct to the GPs, or we have a hybrid mail solution where we can post letters for those that can't be sent electronically. And then obviously, finally, we introduced the voice technology with Dragon Medical One. So how was this achieved? Back to you, Carlo.
So in terms of how we actually did this, it was a good year's work, and we had buy-in from the top of the organization, and it was not an IT project. We specifically wanted it to be perceived as a quality improvement clinical change project. Obviously, there is a huge amount of IT expertise needed to pull this off, but if it sits in a silo in a purely digital forum, you will not be successful. So we set up a specific transformation group looking at outpatients. We did some process mapping work, which you can see a tiny copy of on the bottom right there, thinking about our current processes and what could be improved. So we had engaged clinical leadership, we had consultants from across all the divisions, and we had advanced nurse practitioners from across the divisions. We knew that we had people on board and we listened to them. Similarly, we had secretarial leadership, and we collaborated with our secretarial body, who understandably were nervous when we did this. And we had union representation as well, to make sure that the decisions we were making were clinical rather than purely workforce related. We obviously developed an excellent relationship with our suppliers. We needed strong board involvement and presented a strong financial case, which was listened to. And then we piloted, and we'll talk a bit more about the pilot in a second. And then after that, we had a period of training and floor walking and support. So I would say at the time, I wasn't in my current role, I wasn't the digital lead, and I was a skeptic, like so many, that this would save me time and help me out. And I was supported in my first few clinics, as were all the consultants, to make sure that I could use this in a fairly pain-free way, which makes all the difference. So the initial impression was of constructive, helpful change rather than a new thing you have to learn to use.
So in terms of training and rollout, I'm not going to talk so much about the training because Carlo's mentioned some of those elements, and you can see some information there on the screen. But in terms of the rollout, it was very important that once the engagement was there and support from the executive team, as well as across the clinician body, that we moved quickly. So you can see that from initial rollout or first service going live, it was then a question of making sure that we implemented quickly across other services. So on the right hand side of the screen, you can see the approach in terms of initially training and some practice, then moving on to using the solution intermittently where there is perhaps a bit more time in certain clinics, then moving on to using it for whole clinics. This also means that during that time, the Dragon Medical One solution is learning the user's voice profile. The user is also developing some of the macros and auto text functions. And then by week 4, the expectation was that this solution would be used in its entirety, that effectively the clinic would be electronic and not using paper, and that by week 6, anything such as the outsourcing or transcribing or the old digital dictation solution would be removed for that service. So the pilot, in a little bit more detail, there were 15 users. This was making sure that we had a broad range of not just specialties and different services, but also hopefully a fairly broad range of accents and people using it for different functions in the sense of short letters and long letters across specialties, male and female, and in particular people with English that is not their first language. And this pilot all took place ahead of the implementation in February 18. Very quickly, just to show you, Carlo's already mentioned some of the problems that were experienced prior to the implementation, but on average, on a good day, we had about an 18-day turnaround for letters, and you can see the process is fairly complicated and convoluted. I'm not going to talk through the individual elements, but you can see there that with the outsourcing and letters or elements of letters being passed backwards and forwards, that's what contributed to the delays. The new process, though, much more streamlined, much more efficient, and effectively for those clinicians or for those letters that didn't need any additional input from a secretary, from waiting for results or anything else, that the letter was completed same day by the end of the clinic or later on that day, and then available to be automatically sent overnight, either via hybrid mail or via the mesh solution. So we cut the 17.7 days down to an average turnaround of 2.2 days.
So in terms of what we've achieved, all of our acute services are now live. This is pre-COVID numbers, so roughly 35,000 letters were being generated a month and we're getting back up there now. I'll talk a bit more about COVID in a second. You've heard the turnaround time is an insanely drastic improvement, and 90% of our letters are sent within 24 hours. And importantly, they're available on our electronic patient record immediately. It doesn't have to go to a cloud service, which then connects somehow to Cerner. It's embedded within Cerner and easy to see. And I should say, we are so lucky that we did this before COVID, because obviously with the move to virtual by default, the move to working from home with our secretarial team working from home, and our ability to do clinics potentially for staff who needed to shield from home with remote access to Cerner, it has made life so much easier, because you can easily get the Dragon stuff working from your own PC. So in terms of a post-COVID world, I think that VR is really essential, particularly as we move to digital by default. Paul's just going to talk a little bit about uptake.
So just to show you some nice graphs to demonstrate not just implementation, but also adoption. So at the top left, you can see the license activity. Effectively, what that means is the licenses that we had released, which is the black line, and then the licenses that were assigned. And so you can see that quickly from March 2018 onwards, we moved through services and through areas, ensuring that the solution was being adopted and being used, which is reflected in the total lines and the lines per hour and the distribution of users. So effectively, within the course of that calendar year, we moved from implementing in one service to adoption across the organization, but also people proven to be using the service and the solution and effectively becoming super users or power users within a very short space of time. And then finally,
just to finish off, we thought we'd give you some quotes. Quotes seem to be flavor of the day. So here's some quotes from us. So, I mean, our patients really appreciate this. They get their letters quicker. They want that information, particularly for me as a geriatrician, being able to have that information that then they can show their relatives, particularly in a world where we can't have huge families coming into the consulting room anymore, is essential. The way we set it up is that the fonts change, so it's a much larger, more legible font in the patient copy, and you can set all of that up, and that's very helpful without any extra work. So as you can see, our patients said they get their letters more quickly. Consultants, so it's fair to say that you will have your naysayers and people who have been doing the same thing for many years. But people get used to it, and even I was a bit of a naysayer at the beginning, and now I couldn't go back. The ability to just do it when I'm able, when I want, and know that it's done, in particular not having to bother our secretaries who are incredibly busy doing other stuff with a straightforward 5-line letter that requires no actions, is amazing. There's no need for a human to be involved in that, and that information gets transmitted instantly. Particularly if you're suggesting an urgent drug change to primary care, that is so important and helpful. People thought it was going to be a lot worse than it was, and it has turned out to be incredibly easy to use. And primary care really appreciated it as well. So having the relevant information summarized, and you saw the way we built our letter form to guide people in writing sensible letters, made life a lot easier. And the efficiency is obviously something that primary care really appreciate as well. So overall, we think it's been an incredibly positive experience. Thanks.